Hi guys, my name is Tammy and I'm a doctor of physical therapy. In this video, we are going to be talking about exercises and movements we can do to help with lower back pain, and that feels better with flexion movement. Now, if that sounds super foreign to you, please watch the first video where I talk about how to do a screening to see what movements are better for you. I will call this video number 1, lower back pain, so it's easier to follow, and I will leave a link to that video in the description for you. Again, make sure before you do any of these exercises to read the indications, contraindications, and red flags, and take a second to look at the disclaimer. I'm going to show you the exercises. At the end of the video, I'm going to go over what could be the reason why we have this pain and what are other recommendations that we can try to incorporate into our daily routine to help reduce the symptoms that we're feeling. We are going to start our exercises with a standing flexion movement of our lumbar spine, okay? Again, remember, the way you know this is a good exercise for you is that once you're doing this exercise, your symptoms, which is lower back pain, traveling down maybe towards your knee, your calf, your ankle, and even maybe your toes are going to centralize, okay? So instead of feeling it in your toe, you might feel more pain in your lower back, but you feel it no longer below the knee, right? That's what you want. That's great for us, guys, okay? So go ahead, find a comfortable position, stand up. Feet are hip width apart, and we are going to start with just 10 flexion movements, okay? So you can either put your hands on your hips or you can relax them. You're not doing a deadlift, it's not a flat back. You have to actually bend and see how far you can go and slowly come all the way back up, okay? So even you might tell me that you have the reproduction of symptom when you reach all the way down, so avoid that end range movement, okay? Just go as far as it's comfortable. That's 3, 4, make sure you're breathing, 5, okay? Let's say you did till 10 and you stand up and you're like, oh yeah, well, you know, I feel much better, my symptoms are no longer below my knee, maybe it's in my knee and up, or you might even tell me you don't feel it in your knee anymore, it's just in your hip. So if this was good for you, you are going to repeat this movement about every hour, every 2 hours, you guys. This is, again, repetition. This movement helps alleviate pressure on that nerve that's causing your issues, right? So the more, the merrier, okay? Then for the next set of exercises, we are going to go back down on our mat. Okay guys, so for the next set of movements, we are going to be on the floor. What I want you to do for me is find a comfortable position. You're going to lie on your back. You're going to hug your knees into your chest, bring your knees in, and take it back down, okay? So it's very similar to what we did in standing, but now we are doing this lying down, okay? So I'm bringing my knees all the way down, back up into my chest, and see how that changes your symptoms again, right? And you can repeat this 10 times. Once your symptoms are reduced and you're like, you know what, Tammy, I barely feel my back pain, now we need to try to incorporate movements or exercises that will prevent this from happening again. I will provide a link for you guys in the description for videos that will go into more details about stretches and strengthening exercises, but here we are only going to do simple ones together. So the first exercise we are doing is called a single knee to chest. So again, you're going to be lying down on your back, one leg is straight, the other leg you bring it into your chest, and we are going to hold this for 30 seconds. Again, you can either hold on top of your knee or underneath, and you should feel a really nice stretch in your bum. If you want, you can keep the other knee bent and see if that makes it easier for you. Takes the tension off your lower back, and bring your leg down, and we try it on the other side. Again, this is single knee to chest, and you're repeating it 3 times and hold 30 seconds for each. After you're done with this, you are going to do a double knee to chest exercise. Bring both of your knees up, interlock your fingers behind your knee, and really push those knees into your chest And if you want here, you can go side to side. Again, none of these exercises should reproduce your symptom. They shouldn't make you experience that referral pain down your leg, okay? If it does, just stop doing the movement, okay? Bring both of your legs down. And the last thing we're going to do here is a gentle rotation movement, okay? So again, we're going to go slowly side to side. And if you want, you can even leave your knees on the floor for a little bit, then go to the other side and hold the position for a little bit longer. So these are great stretches that you can incorporate into your daily routine, especially once your symptoms have reduced. The next exercise we are going to do together is very gentle strengthening exercise. So what I want you to do is we are starting with posterior pelvic tilts. Basically, I'm going to take your hands, put it right on your hips, then you're going to tilt your hips into the floor. I'm not doing a bridge, I'm not lifting up. All I'm doing is I'm tilting my lower back, making sure my whole back is on the floor, holding it for 5 seconds and letting go. Let's do that one more time. Bring it in, hold 1, 2, 3, 4, 5, relax. Now tap into your body. See, are you squeezing your glute muscles? If you are, let it go, relax it. Just do that tilt, hold, and let it go. The second and the last strengthening exercise we are going to do in this video is going to be an isometric strengthening. So what I want you to do is take both of your hands, do that posterior pelvic tilt so your back is glued to the floor. Take your hands, put it on top of your thighs, and then with your hands you're going to push into your thighs and hold it for 1, 2, 3, 4, 5, and relax. Now, you guys, I'm not lifting up. My shoulders are relaxed on the floor. All I'm doing is I'm pressing into my hips. 1, 2, 3, 4, 5, as I try to engage my core. If you want to make this a little bit harder, bring your knees up. Put your hands on top of your knees and push against each other. If I go too far down, my back's going to get lifted off the floor. So I keep my back glued to the floor. And 1, 2, 3, 4, and 5. Again, for the strengthening exercises, you can do each like 10 times, 3 sets, hold 5 seconds each time. I'm done with the exercises I wanted to show you here, but one thing I want to mention is that although flexion exercises were helpful, once you're done with having those symptoms, you need to incorporate extension exercises into your routine, right? So an easy one would be to just go on your tummy and prop back on your elbows, making sure your glutes are super relaxed. You can't do this exercise at the beginning because this is what aggravates your symptoms, right? But once you're done, let's say you go a week or 2 weeks without having any pain, you can start incorporating extension. And in this position, you're going to hold this for about, maybe 30 seconds, go down, then try 1 minute, go down, take a break. And if you want, you can also watch the exercises we do in the extension category, because once this is resolved, you want to make sure you're able to bend forward and backwards and sideways, right? You don't want to limit yourself to just one movement. Okay guys, now I want to tell you a little more about who would have this type of condition. So usually people who have stenosis will really benefit from these exercises. Again, stenosis is when there is degeneration in our vertebrae and it's causing that canal that your spinal cord goes through to get narrower, and it's pressing on the nerves, right? For these people, usually they tend to be over 65 years of age. Usually they have a lot of pain with standing and walking, especially in their calves. It feels like a cramping sensation, but if they're sitting or they're in bed rest, they actually feel great. They might also be having changes in sensation in certain parts of their leg, and might be having weakness in the same muscles that correspond to the nerve that is being affected. And now once you start doing these exercises and you do feel better, there are other things you can do to help improve your condition. One is, trying to do maybe cycling, even if it's a stationary bike. You can try aqua fitness, which is honestly one of the most healing types of therapy, especially for people who have lower back pain. And if you are seeing a therapist, they might even do a traction for you for your lumbar spine, and that might give you a lot of relief. Please make sure to read what I've written for you in the description. It might go into more detail and might give you a better understanding of what we're talking about here. As always, if you have any questions, feel free to leave a comment for me. And if you like the video, don't forget to like, share, and subscribe to our channel.